My name is Taka Kitamura from Tokyo Medical University in Japan. First of all, let me thank you for clicking on this video summarizing our recent review paper. As you could see by the title, I will talk about the current situation of EV-based liquid biopsy in cancer. We aim to discuss the feasibility and practicality of EV-based liquid biopsy in clinical settings. Traditionally, the so-called one treatment for all had been the major approach of cancer treatment. However, thanks to the technological advances, it is now possible to understand the cancer pathology in more detail and provide tailored treatment with each patient or patient group. Regarding to this, liquid biopsy has been attracting attention as a powerful tool for understanding individual pathological conditions. As you know, liquid biopsy is minimally invasive and can be performed repeatedly, so it can be useful in many steps in the time course of cancer treatment. As shown in the first figure, it can be used for early diagnosis, monitoring, and treatment selection based on the prediction of treatment response. As shown in the second figure, there are various candidate analytes for liquid biopsy. Among these analytes, EV-associated markers, especially EV proteins and EV nucleic acids, are well studied to clinical application for the following reasons. First, EVs are released by cells into various body fluids by active secretion, whereas all other candidate analytes such as CTCs, cell-free DNA, and extracellular RNA are mostly released by passive secretion. Therefore, the molecular composition of cancer-derived EVs would reflect the current status of their living parental cells. Secondly, EV-associated markers are stably preserved owing to the EV's lipid layered structure. Thanks to this stable structure, EVs from body fluids can be analyzed after being stored for a relatively long period of time. Finally, these molecules can be relatively easily analyzed by using existing technology such as mass spectrometry for proteins and NGS for nucleic acids. Of course, there are still many issues left unsolved. For example, clinical use for EV isolation method is still unestablished. Some current techniques are not very adequate to use in the clinical due to the time-consuming processes. To overcome this problem, in the last decade, great efforts have been devoted to establish clinical useful platforms for direct detection of cancer-specific EVs without any isolation or purification procedures. Almost all of these techniques target EV proteins and EV RNAs. As you can see, Table 1 summarizes some remarkable protein markers in EVs. For instance, it is reported that PGP, a drug efflux pump, is shared by prostate cancer cells. One cancer cell transfers it to another, helping the later cancer cell to acquire chemotherapy resistance. The protein PGP is carried by EVs and can be used as a biomarker to predict chemotherapy resistance. And one step further, by using molecules with actual biological functions as biomarkers, it is also possible that these molecules can be target of cancer treatment. Similarly, Table 2 shows a summary of remarkable RNA markers in EVs. As I mentioned before, biomarkers can be used in multiple steps of cancer treatment. For diagnosis of prostate cancer, XDX prostate is already commercially available test, and it's based on the detection of specific RNAs in urinary EVs. Regarding to treatment selection, it has been reported that the level of PD-L1 messenger RNA in blood EVs derived from lung cancer and melanoma patients could predict the efficacy of immunotherapy. Recently, immune checkpoint inhibitors have attracted a lot of attention in clinical settings, so this study is worthy of attention. As these examples, we focused on discussing the biological or clinical significance of reported candidate biomarkers. Detailed information of each study, such as cohort size, patient background, AUC value, and OS period, are not included in these tables. But these are, of course, important factors, so please check the listed references. Lastly, I would like to remark that EV-associated biomarker science is a promising area of cancer research, although there are many issues to be solved. We hope this review will help you research over your daily clinical practice. And once again, thank you for checking out this video.